Bismillahirrahmanirrahim. Dear viewers, Assalamu alaikum. I'm your host Faisal Raza and you are watching Foresight. Viewers, mental health issues are alarmingly widespread across Pakistan. Almost every household has a chronic mental health patient among relatives or friends. Mental health patients need urgent and appropriate medical or rehabilitation facility for treatment. According to the World Health Organization, an estimated 45.5 million Pakistanis suffering from mental disorders. Depression, anxiety and schizophrenia are the most common disorders among most of the Pakistanis. However, only 10%, yes, it is a very serious issue that only 10% of the individuals with mental health illness receive any form of treatment due to the factors such as societal stigma, lack of awareness, inadequate resources and limited access to the treatment facilities. Sometimes stigma lead to, particularly in individuals or in groups, lead to marginalization, which impacts psychological and push them in distress, stress, anxiety and depression. These disadvantaged people are often facing prejudice, discrimination, social exclusion and impacts on their well-being, especially related to the mental health. This is a very important issue which is rising at an alarming rate in Pakistan due to various reasons. To discuss this vital aspect, we have in our studios Dr. Humaira Jami. She is Assistant Professor, National Institute of Psychology, Center for Excellence, Quaid-e-Azam University. Most welcome to you, ma'am. Thank you very much for your presence here. And with her, Dr. MAlik Ahmad. He is the Human Rights and Peace Educationist. Most welcome to you, Dr. Ahmad. Thank you very much for your arrival as well. And online joining us, Dr. Murtaza Ahmed Khan. He is the physical health expert. Most welcome to you, Dr. Murtaza. Thank you very much for joining us online. My first question to you, Dr. Hammad, that what are the disadvantaged groups in our society? The most vulnerable, like racial and ethnic minorities, the gender-based and sexual minorities, or special persons, or the low-income people particularly, or people who are below the poverty line?
Thank you so much, Faisal, for inviting me to this very important topic of today's world, not only for Pakistan and Pakistanis, but globally as well. Since it is part of the Sustainable Development Goals, goal number 3, which is on health, 3.4 is mainly, targeting mental health well-being. As far as your question is concerned, if we talk about the Pakistani society and the Pakistani community, and amongst the Pakistani community, the most vulnerable and disadvantaged people are those which you just mentioned. All of them are very much disadvantageous in one way or the other. However, I would say it's because in Pakistan we also have the patriarchal system overwhelmed in the country. So the women in that form, if a Christian woman related to minority, sectarian minority, racial minority, if we talk about like the economic classes minorities, which means like the poor. So the poor of the poor, the most vulnerable of the vulnerable is women. And person with disabilities, if we talk about, so then even if it is a woman, then it is more the most vulnerable segment of the general society. The rest, I mean, of course, like we have many issues, attached to our community because of the economic issues, because of our economic, like the strength the country has. So definitely, so we try to provide or support those persons who can, give you back something. So instead of, because these, whatever the groups you talked about, the disadvantageous groups, so to them, basically the state or the government or the people, they have to give them without thinking or like realizing that they would give you back something. So that like comes sometimes.
Means according to you, women are the most vulnerable and the most disadvantaged if they are from any minority segment. It can vary through the situation and whatever circumstances those are. So, Dr. Humaira, how does the stigma manifest in a society actually? And what are the common characteristics or attributes that may lead to such situation of stigma particularly?
Thank you for asking the question. I am so very grateful for inviting us on this forum. Well, stigma is actually whenever we are labeling some individuals based upon their specific attribute, characteristic or quality, which is different from the mainstream people, or which is different from the normative behaviors or characteristics which are existing. For example, the person who is disabled, maybe the person who is having mental health problem, or the person who is gender or having sexual based characteristics which are different from the mainstream. So these individuals are actually stigmatized and they are being labeled that they are different. So I won't say that they're the people who are deviant, because this term is not taken to be a good statement. The thing is that they are different from us, and since they are different and we are not able to understand them, so we stigmatize them and label them. That starts affecting their health or well-being after some times, because they start internalizing that stigma, which
without realizing that it's not sin basically. It's if they are different, that is natural, and we have to behave natural.
It is just like, for example, the people who are overweight, we stigmatize them that they are obese. The people who are very tall, we say that they are just like pole or something like this. So
and if anybody writing from the left hand, they are always stigmatized in our society. So how does stigma actually contribute to prejudice or discrimination or social exclusion? Such type of impacts actually the individual's well-being and access to different opportunities?
In many ways, because once people are being stigmatized that they have specific characteristics, that can be in both extremes. For example, the person I've just told you, the child who is gifted and very intelligent, they are also stigmatized in the class. If the person is arrogant or something like this. So similarly, the individuals who are having some special different characteristics, because they are not accepted by the people, and people start becoming judgmental about them. So prejudices are actually our judgments which are not based upon the correct information. They are irrational and they are based upon misinformation. For example, if I just give you an example of Khwajah community, they are the people who have a lot of myths. We believe in those myths, and these myths actually make us judgmental about them, and we do not know actually who they are and what are their capacities and how they can be productive. So once we become judgmental, our point of view becomes very tunneled. So we do not want to interact with them with open heart, and that starts affecting, starts making us more biased. For example, in the hiring process, we may not be hiring, just Dr. Saab has said that we may not be hiring women because we think that they are not intellectually sound. We may not be taking them very competitive. Maybe they are having the same level of education, because we have a tunnel view that men are more good leaders and they can have good executive positions. So because of these stigmatization and stereotypes, it starts affecting the person's
We are not knowing anybody, we are not examining actually, but premeditatedly we have some sort of characteristic which is already built in our mind. That is also a mental health issue, you know. So Dr. Ahmad, as ma'am said, that do you think that in our society, majority has the biases on very high notes, as Dr. Saab is actually explaining, and they influence these judgments and decision makings when and where it is necessary? Because sometimes our half judgment or sometimes half cooked thing or some sort of illusioned decision making is actually ruining somebody's whole life.
Actually, yes, we do have. But one thing, is very important to say, that biasness is natural, because wherever you live in, whatever kind of upbringing you receive, the training you went to, or the school, something, wherever you are, basically you build something liking and disliking in your personality. But once that biasness comes to destroy, out of your way where we see that should be a part of the national merit or the local merit, or something where we say that the society has to be on merit. instead of, due to my liking and dislikingness, I should propagate that, or I should hire that kind of people in the community.
Because as Dr. Sabah said, that sometimes we have seen in a very high competitive exams, and after that the interviews and all that, there also when you need merit, you have to be very strict on that line, because there is a very thin line in between the decision making and what we say, the half judgmental or all that. So that actually, I was asking that question in the same way, that it might ruin the life of anybody who is in front of you, and you are just a judgmental because of some sort of a characteristics that was developed already in your mind.
Indeed, it is not only at the competitive exams level. It starts from the school level.
Yes,
and
definitely.
That is much more important.
At every level.
That is much more important, because the school level or the university, student life, if the student faces any kind of biasness, and due to that biasness, like his or her career, academic career, does not flourish, so then it means that for the rest of the whole life of that person, that student gonna be affected with the mental, disturbances, the anxiety, and sometimes, it goes up till the depression and, post-trauma kind of situation. So, yeah.
Your point well taken. Dr. Murtaza, what are the effects of marginalization on individuals or groups? What are the consequences on particularly health, education, employment, and overall well-being of a person or a group?
First of all, Mr. Faisal, I would like to thank you for inviting me into such a thought-provoking forum. And as a physical health expert, I must emphasize that marginalization has far-reaching consequences that extend beyond social and economic realms, profoundly impacting on individuals, group, or overall health and well-being. And these effects of marginalizations, there can be from acute to chronic stress responses, and they trigger a psychological as well as a physical impact on a well-being, and it affects the various aspects of health, education, employment, and overall quality of life. First of all, I would like to elaborate some of the health consequences, and increased stress hormones is the most commonly found commonly found in these people, and chronic stress leads to elevated cortisol level, and they contribute to anxiety, depression, and various cardiovascular disorders. As far as these stress responses are concerned, they also weaken the immune system, and prolonged stress suppresses the immunity of a person, and it makes susceptible to more infections and diseases. As well as health is concerned, they have poor mental health, and marginalization can lead to higher rates of depression, anxiety, suicidal tendencies are increased in such patients, and they have a relatively higher susceptibility of substance abusers. And as far as these impacts on mental health, they also lead to chronic diseases, and they have increased risk of hypertension, they have increased risk of diabetes, obesity, and they have poor living conditions, and they have limited access to healthcare and unhealthy coping mechanisms. And overall, these all also impact on the reduced life expectancy as well.
You are talking about right now the marginalization. So how actually the stigma, if that comes with marginalization, and what sort of impact psychologically a person, individual has related to whether he or she goes into the distress kind of situation, stress or anxiety or depression, or all kind of situations together, and what kind of health deterioration or health impacts he or she feels actually?
Basically, it starts from reduced self-esteem and sense of belonging. The patient or a client, they have increased feelings of hopelessness and powerlessness. They have decreased social connections, and they have community decreased engagements, and overall they affect the quality of life very badly. And this all triggers a cascade of psychological, emotional, and it eventually leads to physical disabilities. And in conclusion, I would like to say marginalization has severe and far reaching consequences for individuals and groups, affecting not only their social and economic status, but also their physical and mental health, education, employment, and overall well being.
Okay, your point well taken. Your point well taken. Dr. Humaira, when we overall watch the society, how actually you categorize or define prejudice, the emergence of stereotypes, and how they impact actually the society groups or individuals altogether?
I just mentioned earlier the prejudices are actually are judgments which are based upon misinformation, and they are generally irrational and they are not correct. And how it is being built is based upon our stereotypes, our belief system about specific group. That may be about a race, about an ethnic group. For example, we have different opinions about our ethnic group, like Punjabis or Pendus, or maybe Pathans are aggressive. So in that context, once we have a stereotypic opinion about people, then we base overgeneralize this information based upon one individual onto the whole group, and then we start interacting with the people in that tunnel view, and that affects our social interaction in daily life, and that limits accepting the diversity and to be inclusive in every domain. Like this organization is a service providing organization. So if you are stereotypic and you have some stereotype about a woman for that matter, you will not be able to open up in the discussion.
By the way, I am not.
I do understand, but you will not be able to open up in the discussion with the person. So similarly, if I am having some concerns related to men, women are taken to be bad drivers for that matter. So these are stereotypic opinions. So generally, I went for a license, and myself and my husband went together, and the police officer said that if he's going to fail, you're also going to fail. So he said that he's just telling that he's more competent than me, but I passed. So
that's great. But unfortunately, that is the phenomena which is existing, unfortunately, very heavy in our country, in our society, and it is on rising actually. It is not diminishing. Dr. Ahmad, what are the social consequences for any sort of survivor of trauma and abuse, and how institutional and other barriers could mitigate to protect vulnerable population from such type of situations or such type of mistreatments particularly?
Faisal, like the social repercussions are so grave, because if we are not mentally, healthy, or if our well-being is under question, we are not able to produce or promote our 100% skills and our 100%, like production, which as a person, as an individual, I have for the society.
Sometimes there would be an inferiority complex or something like that.
Like that inferiority complex, and even the stigmatization, the biasness. So, these kind of things, we in Pakistani society especially, like we even do not cater that gonna help, that gonna have some kind of bad impact on that one person's personality. If we, commented on one person's like any kind of stigmatized position. But on that person, it's gonna be really hard, especially if someone is working, for instance, and boss says that, oh, you are just, goof, for instance. So it's a simple, just one statement for here, it's very casual and normal. But that statement gonna, destroy the mental health of that person. And once the mental health is destroyed, then, like the production of that particular person, you are not going to have well
said, Dr.
Even the physical, like if we ask, even if you are physically not fit but mentally fit, you can be a very active part of the society, progressive society, and you play your role very well.
Definitely, your point well taken. Dr. Murtaza, as Dr. Ahmad said, that why do individuals from disadvantaged groups delay in seeking help for mental health concerns or disorders particularly?
Basically, I can explain that why these individuals delay in seeking medical health. First of all, they have lack of access. They have limited healthcare resources, transportation, and a lot of cultural barriers can hinder access to the mental health services. And secondly, cultural and societal stigma surrounding mental illness can prevent individuals from seeking help, fearing judgment and labels. They have also a lot of trust issues, and trauma and systemic racism can lead to mistrust of healthcare systems and providers. And basic needs like food, shelter, safety maybe take precedence over mental health concerns. And they have limited mental health literacy. Disadvantaged groups may have limited understanding of mental health issues and available resources. And they also, some of the people also have fear of diagnosis, that they may be labeled as crazy or diagnosed with a mental illness that can uh, that may further needs help from the medical aspects. And the society is the main concern, that they have a fear of diagnosis, that what will society will do for them, what if they know that this person is having bipolar mood disorder, or he is having schizophrenia or something like that. And some people also have cultural and religious beliefs, and they have very strong beliefs. And in few communities, language barrier also cause hindrance in seeking the medical attention. And I think sometimes when a person is isolated, and he kind of shuns all of the world, and he goes into a dark corner, and he doesn't try to go for the seeking medical attention, and his willpower is so low that he cannot go and talk to the people. And because of that depression, anxiety, they feel so lonely that they cannot connect themselves to the world.
Quite well taken, Dr. Humaira. We have watched closely that many disadvantaged people or marginalized people are often treated with sheer discrimination. And so, how does actually the misgendered or some sort of dead naming affect particularly a transgender person? Because they are mistreated in every corner of our country, basically.
Well, thank you very much for highlighting this question. The important thing is that once we were coming here, you were so particular about our name, and you were just sharing with us that see if the spellings are correct, if the name is correct, and you were also concerned about our designations and our
Definitely, we have to be cautious for that.
Yes,
really.
so it means that you are giving us respect, and you are considering, because
that is actually the first respect for any person.
So this is a part of our identity. So since name is the first part of identity, and how we want to be acknowledged is actually very important for any person. So for example, we have been nicknamed in childhood Munni, Munna. So now these names are dead names. So if anybody comes across suddenly and they say, Munni, how are you? So you, oh, so you don't like it. So similarly, the people who are transgender, so these people have, if for certain reasons, being in a certain community, they have changed their names, they would love to be called by that name. And similarly, if you are looking at some person and you think that you are not able to make out either the person belong to a female gender or male gender, it creates confusion, and it is a state of ambiguity. So that results into misgendering. So we should be avoiding that situation, and in that situation, it is better to use neutral terminologies rather than sticking towards pronouns related to he, she, or I think Urdu is a beautiful language which is a plurality, like aap, hum. These terms are available in Urdu, and we can very well use, and interestingly, West has borrowed this concept from us. Now, if you are not clear about the gender of the person, they prefer using they rather than using he, she. So similarly, if we talk with the person, aap aa rahe hain, aap ja rahe hain, this is much better than saying aap ja rahi hain ya aap aa rahi hain, if you do not know the gender of the person, because with the passage of time, things are becoming very, gender is becoming not very strict in terms, I would say. So we need to be considering that how a person wants to be called, we should be giving respect to that person with their names also and with the pronouns also.
Definitely. Dr. Ahmad, why not mental health services, legal aid and support mechanisms be improved? And how can a societal stigma and cultural norms be addressed to encourage survivors to report and seek help in any kind of situation?
Faisal, I think, in my opinion, of course, like government is doing something on the mental health policy. There is a mental health policy, and And then, of course, like after 18th Amendment, it is the subject of the provinces. And then the provincial, have their own mental health policy, and the centers where they try to, address these mental health issues. But the thing is, we do need to work on various levels. It is not that the government only should establish centers. It is also the non-governmental organizations, it is also the civil society in general, where they should work not to address, the catering of these mental health problems, rather I would say preventing the mental health problems, so that we should have lesser issues related to their mental capacity. But the thing is, there are various things, related to human rights, because it's a part of human rights as well. So mental rights, mental health policy, well-being is a part of our human rights policy. So we need to end the stigmatization. We need to work to make them, instead of, tagging them pagal, mental patient, or, it has some kind of, bad omen on that particular person, and it is not good to meet that
we
person.
have to always avoid bad naming or something like that.
But once you attach someone, even in in joke, that tagging of the name becomes
even
part
a
of
healthy
that
person is going to be irritated. Definitely.
And that influence comes on that particular person. So we basically need to work hard. There is, of course, like the government policy, and then there is commission, National Commission on Human Rights, NCHR. They published a very good report in 2022, where they at least brought up the mental health issue in Pakistan. First of all, they gave the, the facts and figures, that how much percent we have, for mental health issue in Pakistan. Like 1/4 of the whole population has been facing this issue in one way or the other, lower level or the acute, level. But catering and addressing that, we need a very strong policy and implementation.
Very right, very right. Dr. Murtaza, most of the times we have seen in our society that even the mental disorders or some sort of mental sickness never be taken as the health issue, number one. And the second is that what are the social determinants of health that put actually disadvantaged or marginalized people, individuals at a greater risk? Because especially regarding when we are talking about the HIV prevalence among the youth and some sort of domestic abuse which is on rise.
So, as a physical health expert, I may say that these people who are having some sort of psychological issues, they kind of make a barricade in front of them, and they make a shell, and in which they are subsiding, and they have to break the shell first of all. And apart from them, social determinants of health that put disadvantaged and marginalized individuals at greater health risk. They are particularly regarding HIV prevalence and among youth and domestic abuse are top on the list is poverty. They have limited access to the healthcare, healthy food, and safe living conditions. They are not educated at all. Their education level is very low. They have limited knowledge about their health, and their resources are very scarce. Housing, as far as is concerned, they have unstable and inadequate housing. They have increasing stress and health risks. As far as employment is concerned, they have unstable or low paying jobs. They have limited access to healthcare and resources. They are socially isolated and they are discriminated. For example, they are experiencing racism, homophobia, transphobia, and other forms of discrimination. And as far as healthcare is concerned and its access, they have a very limited access to the healthcare, including HIV initial testing and treatment. And they don't even know about their testing centers and where the government have provided the setups for their initial diagnosis and treatment for such diseases.
So when we are talking about Dr. Humaira, that what is the significance of using affirming language, respecting the individual's chosen names and pronouns in actually the service providing settings overall?
Generally, I have just mentioned earlier, it is very much important. For example, I will just give an example that our mind and our languages are so sexist in nature that it is very difficult to get away from that. Once I start teaching this, my course in psychology of gender, I do ask one question from the students, write down the first day of the student in university, the first day of the student in university. So the students start writing, Ali came in university, he did this, he experienced this, he, because the student, what comes in the mind is maybe a boy who has come to the university. So in that way, that limits the opportunities for the other people who are diverse to actually being acknowledged and being, you know, being accepted in the given environment, in the situation. And just giving an example, for example, people send us emails and sometimes the names are very neutral, like Rahat, Farhat. These are names which are applicable to men and women both. So sometimes we do not know the gender of the person and we wrongly write he or she something for them. So then they get retaliate, they get offended that I'm not a man, I'm not a woman. So that is an embarrassing situation for us. And even if we are corresponding with the people who are abroad, we do not know their names actually by gender, because sometimes we do not know Daniel is actually woman or man. So that creates an embarrassing situation.
So what we have to do in that such kind of situation?
Avoid using sexist language. Now we generally use he, she with slash, or we use one, or we use they. So there's a chairman, now chairperson.
Okay.
So these terms are now available, readily available. So we can help our service providers to learn those languages to be more accommodating and accepting the diversity.
Not the fireman or the firewoman, but the firefighter.
Firefighter.
So definitely it is very important in that aspect particularly. So what percentage, Dr. Hammad, of Pakistani employed women in vulnerable jobs particularly, poor working conditions as comparable with men, and how such conditions affect their overall well-being in any kind of situation?
You know, like in Pakistan, of course, as I mentioned in the opening statement, that we live in a patriarchal society. And unfortunately, under that patriarchal society, we, you know, look at women, you know, lesser competitive, you know, since we have been talking on that, one thing. Second is, even if due to the...
This is the perception, not the reality, basically.
Not the reality, but the perception, one thing. The second is, like, due to the economic, you know, need, women, they have started, you know, coming for the job market. But once we ask them to come to the job market, it is our responsibility, is the responsibility of a civil society and the government mainly, to give them that security. And security means the body and the human security both.
Obviously.
That security, so that they can work, you know, freely, independently, and with their full potential. So until unless they are not without any fear, fear of being harassed, fear of being, you know, like the marginalized, disadvantageous, putting them into a disadvantageous group, you know, sitting them behind because they are the women, instead of, you know, looking at their capability, look at their sex, you know. So that, until unless we do not remove these barriers and stigmatization to women, we would hardly bring their full potential to our economic growth.
Definitely.
And, you know, in the global world now, we need, you know, and work from that 50%, you know, population of our country.
Definitely, your point well taken. Dr. Murtaza, what are the vulnerable groups affected by trauma, violence and abuse? Their common causes basically, and effects on individuals and communities, and what are the treatments for that?
So the most vulnerable population are the children and adolescents, women, especially those in abusive relationships, refugees and asylum seekers, and as the ma'am was saying, LGBTQ plus individuals, people with disabilities, ethnic and racial minorities, and low income communities. They are most vulnerable. And the common causes they have that sexual assault and harassment, intimate partner violence, community violence, bullying, and cyberbullying. And they kind of affect the individual individually, as well as they have effects on community as well. The person suffers, they can go into post traumatic stress disorders, they can go under depression and anxiety, they can go for seeking drugs and having substance abuse. Some people or patients come to us with chronic pain and somatic symptoms. They have sleep disturbances and they have difficulty with their emotional regulations. As well as communities are concerned, they have social and economic disparities, community fragmentation and mistrust, and integrational trauma, and they have limited access to resources and support. And as far as treatment of such patients is concerned, so we have very well established departments in our working setups, and there's trauma informed care, cognitive behavioral therapies are being started initially, and group therapy and support groups are also there for them, and family therapy is also done because that individual needs to be taken out of this stigmatization and trauma. And community based programs and advocacy, and specifically the program which you are also connecting, is also a part of educating such peoples. And if early intervention and prevention and such programs fail, then we go for the medical therapy as well.
Okay, your point well taken. Your point well taken. Dr. Humaira, what does internalized stigma like shame or self-blame affect the self-esteem, self-efficacy, and psychological well-being? Do you think that its impact on mental health is also going to be very severe?
Yeah. Actually, if I ask you that who are you, we generally start telling us about us, what people think about us. So I'm intelligent, I am outgoing, I'm social. So once we ask that, how do you know that? People tell. So once the people are being stigmatized, then the person who is experiencing it, they start internalizing it, that I am bad. So it's a culture of, generally, I won't say, we must admit this thing, that we have culture of shaming. We do shaming a lot, and this is one of the parenting technique also, which has been found, that we try to control our children.
An individual goes actually into the self-centered psychological trauma.
Exactly. So this is just like shaming, and if you compare the culture, Eastern culture and Western culture, the Eastern culture is more shaming oriented. So we shame a lot, and the person starts internalizing that there is something wrong with me. I am bad. And it creates shame related emotions. And those who are in the Western culture, they go induce guilt more, that I have done something wrong. So having done something wrong or I am bad, there is those two different things.
There is a huge difference.
If you have a guilt, then you will try to rectify the things. But if you have a shame, then you internalize that thing that affects the well-being, and it causes depression, anxiety, stress, suicide, and you feel that you are worthless and people are not going to accept you. People who are disadvantaged, or those people who are in specific, those stigmatized, they do not disclose their identity. They will not show that which ethnic group they belong to, they will not show which religious group they belong to, that they fear that they are going to have negative repercussion because of that. So we internalize the stigma that there's something wrong with me, something wrong in my caste, in my ethnicity, and I should not be disclosing that thing. So that causes a lot of issues in well-being, both psychologically, physically, and socially, and all
Obviously,
that.
obviously, well said. Dr. Hammad, what legal acts and policies in Pakistan support the protection and advocacy of the disadvantaged people, their rights, and how to create a safe environment for them?
Pakistan is one of the countries where we have abundance of laws. It is one of the countries where we have developed and formulated laws related to human rights.
Even sometimes most of the people say it's over-legislated.
Over-legislated,
definitely.
Indeed. And sometimes overlapped.
Yes.
Well, we have commissions working for the betterment of and promotion and protection of human rights in the country, including mental health issues, National Commission on Human Rights. And then if we talk about the women, then we have National Commission on the Status of Women in the country. And if we talk about girls and boys, children, then we have National Commission on the Rights of Child in this country, and National Commission on Minorities is also in process to be established well. And of course, on the above of all these, we have Ministry of Human Rights, who is basically working for the betterment of the citizens of this country. The question is the implementation. You know, once we talk about the implementation, once we have surveys, you know, related to mental health or any, you know, disadvantageous group segment of the society we have in this country, then we see that we are failed to deliver at this point. You know, even law enforcement agencies sometimes, you know, they do not know that that kind of law has been implemented in this country, national level and then provincial levels, you know. So in Pakistan, we do need to work hard for the implementation of what we have already, you know, developed, formulated, which is also part of our, you know, constitution, as well as we are signatory of, you know, a couple of like 7 conventions and covenants related to human rights, in which all these disadvantageous groups, you know.
So what's the status of implementation across the country?
Of course, like after 18th Amendment, the implementation status, most of these things are at provincial level. It's a provincial subject. Yes, it's a completely provincial subject. And then, you know, every province has its own policy, has its own, you know, recognition and, you know, plan of action for delivering that laws, you know. But the thing is, until unless we do not have good training mechanism of the law enforcement agencies, until unless we do not have, you know, good civil society, vibrant civil society. We do have good civil society, but the vibrant civil society where they could go and even talk about those, you know, issues which are stigmatized or taboos.
Definitely,
you know. So
civil society with the technical knowledge as well, because definitely it is important. And this subject, mental health issues, these are very important.
Very important.
So, Dr. Murtaza, what are some ways to promote social cohesion, inclusion, support marginalized groups, like improved healthcare infrastructure, services, and ensure equitable access of all?
So basically, it's a very vast question, and literally the answer to this starts from a single individual, and it goes on to the communities, and the government is the next forum which takes an action to control all of these issues. So as far as individuals are concerned, they should be given education, and they should be helped out, and we should have community health workers which are highly trained, and they help the marginalized groups to provide culturally sensitive and support, and they should immediately seek attention, and they should be accessed easily. As far as community engagement is concerned, they should encourage community participation in healthcare decision making through town hall meetings, focus groups, advisory boards, and our health system, specifically speaking, in our various government and private setups. There are a lot of doctors who are right now working on specifically on mental health of the individuals, so specifically young and these marginalized people, and they should immediately seek attention. The government should provide adequate facilities to the health department so that they can make such centers, and they are easily available, and they have an access. Such patients have an easy access to such facilities. And we also have to address the social determinants, like screen patients for such issues, and government should also provide adequate housing, food insecurities and transportations, and they should connect them with the resources, and there should be some
your point well taken, Dr. Murtaza. Dr. Humaira, when we are talking about basically on the aspects of the Mental Health Act 2001. So how you take it that in the backdrop of that, to address mental health needs of the disadvantaged communities, do you think that that act is enough and the implementation is on and that is going well, or we need to have more emphasis upon that?
It is very much important to recognize the psychology or psychiatric knowledge as something very important as this program is being run. And according to Mental Health Act, there is a requirement to have the community engagement services for the disadvantaged people, even for all. And they also require the courses and trainings to be implemented to create awareness, like Dr. Murtaza has rightly said. And there is also requirement to have awareness campaigns like you are doing right now, that is for the public. So it needs to have the holistic approach, and just Dr. Hammad has said now it's more of a provincial prerogative how they are going to manage that thing. And if you talk in terms of transgender protection bill, which was passed in 2018, it is very wonderfully implemented in Punjab and also in KPK. But since it's a provincial level thing, so not the Sindh is and Balochistan is not implementing in that way as Punjab is implementing that. So there should be a centralized body which should be also recognizing the psychology and the psychologists and the clinical psychologists, and they should be licensed first of all. And now there is an advent of new concept of telemedicine. So we need to have some ethical grounds in how to give those services. And this is one of the best way of providing mental health services on the doorsteps, because those people who feel stigmatized and who do not want to disclose their identity and they do not come to the healthcare setting, this telemedicine service is going to help them a lot.
Definitely.
Even the women who cannot come out, so it will be very helpful for them to have the access to mental health services and healthcare services.
Technology can make a difference for all those who are stigmatized or marginalized in
Exactly.
in the community overall. So, Dr. Hammad, how can a legal, institutional, social, healthcare and psychological empowerment supports the disadvantaged communities?
I think, like once we have all these laws, as Dr. Jami mentioned, and I said earlier, implemented well with the trained staff, so then we have very much, capability to address this particular issue quite well at every level. What kind of, and of course, like here we are focusing on more disadvantageous people, but the mental health issue is, for everyone in this country because of various social, issues in this country, which are being reluctant to be addressed, either due to the, not having the capacity or due to the delayed like style of our living, for addressing such issues. So human rights in general has to be prioritized well, because this is the human lives who can produce this country, who can promote and who can progress this country very well at the global level. If we do not invest on humans, then like any kind of other investment would be not coming with the very much good results. So the human security, which includes the mental health, and in that we also include those minorities groups in our society with what kind of background, sexual or religious or sectarian, like what kind of background they have. We should stop the discrimination against them and include these groups into our mainstream. And one thing I would also like to clear here, sometimes when we work on the disadvantageous people, the advantaged people or the majority, they think that they are working against us. It is not like something against someone or the other. It is rather to create cohesion.
It is basically for the well-being of whole of the society.
It is basically creating a cordial relationship. It is basically creating a cordial relationship, not the antagonistic relationship between or amongst the various groups of the society.
Obviously. Thank you very much, Dr. Hammad, for your candid views. Thank you very much, Dr. Humaira, for being here in the studios. Thank you very much, Dr. Murtaza, for your very elaborative views on the mental health particularly. Thank you very much for your presence online. Viewers, as you have listen to our panelists, it is important to think about that we have a segment of society and that is growing actually, that is rising, that is the disadvantaged people who have the mental health issues. We have to take care of them, we have to give them respect, and it is important that whosoever stigmatized or marginalized need the utmost care and particular medical rehab treatment in the designated facilities. So for that matter, those facilities must have to be enhanced, and this is not only the job of the government but also whole of the society, who are the people who are having some sort of resources available. They have to contribute into this very important aspect of the human life. Along with that, the community groups, the health practitioners, particularly the doctors, they must have to be trained on that aspect, and they have to contribute for the well-being of the people, particularly who are suffering from the mental health diseases. And whosoever is suffering from that, first of all, he or she or any other person needs actually the care and respect. Create awareness and education, that is very important, and normalize the vulnerability, challenge the cultural norms which are actually affecting those people who are marginalized in the society, promote self-compassion and empathy, patience and persistence. And when we are talking about provide some sort of a sustenance environment to that, and also lead by example. Psychological, healthcare, social, legal, institutional support is very important for them, to the mental health people who are stigmatized or marginalized. These are the disadvantaged people, but when the time is on and when we move on, definitely these disadvantaged people must have to be squeezed, because we need them to be the advantaged one. We need them to be the normal people, and if the society becomes normal, if the society has the cohesion among each other, definitely these societies actually grow, and those countries with such society obviously develop, whether it's economically, whether it's socially. This is today's Foresight. It's time to sign off. Allah Hafiz.